For Phase 1, our goals are to start range of motion exercises without pain, control pain and swelling, and gentle stretching. The modality that we would use is RICE, rest, ice, compression, and elevation. This is a seated hamstring stretch. Have the patient sitting with their legs straight out. The patient's hands move forward towards their feet. This is a passive hamstring curl. Have the patient lie on their stomach, passively bring their leg up to their glute. This is an isometric hamstring stretch/flex. Have the patient lay with both legs straight out. Bring one leg up, have them flex for 10 seconds, and then bring the leg back down, and then bring it back up and stretch for 20 to 30 seconds.
The goals for Phase 2 of the rehabilitation of the hamstring include regaining strength of the hamstring, regaining neuromuscular control, as well as working on towards sport-specific movements and exercises that work on agility and also some sort of explosive movements for support. For this movement, a partner should control the amount of tension on the band for the athlete, and the athlete should move their leg posteriorly as one unit. For the weighted hamstring curls, the athlete should strictly move in the sagittal plane of the lower leg and maintain constant tension on the hamstring muscles throughout the slow and very controlled movement with maintainable weight. For this movement, the athlete should have a slight bend in their knee and avoid rounding their back to make sure that the hamstring muscles are fully worked and developed on.
The goals of Phase 3 are to regain 90% strength in the hamstring, little to no pain with activities, improve neuromuscular control, and ultimately return to play. Good mornings will be done with a slight bend in the knees and a straight back. The client will use his or her hamstrings to lift their body back into the upright position. Single leg hip raises will be done slowly and controlled to focus on the stability of the hamstrings and complementary muscles. During partner bodyweight leg curls, the client will slowly lower themselves towards the ground. At the bottom of the movement, the client will give just enough of a push-off to keep a smooth movement throughout. The knee to chest stretch can be done to stretch the client's glutes and hamstring at the origin. The range of motion in the stretch can be increased by applying pressure to one's own leg. Straight leg toe touches should be done in a smooth and maintainable motion. The client should hold at the bottom of the movement rather than bouncing. Straight leg toe touches should be done in a smooth and maintainable motion. The client should hold at the bottom of the movement rather than bouncing.